Eddie Cabral here with Cabral Plastic Surgery. Today's patient story, no way, BRCA. So this is a 23-year-old healthy woman who was found on genetic testing to have a BRCA1 mutation. And so for those unfamiliar, the BRCA1 and 2 gene mutations confer a significant increased risk for several cancers, but particularly breast and ovarian. And in conjunction with this patient's geneticist and general surgeon, she elected to proceed with a prophylactic or preventative bilateral mastectomy. And so she was sent to me for consultation in regards to breast reconstruction after mastectomy. Her estimated lifetime risk for breast cancer was estimated at over 60%. So here she is in the clinic. She has a size 34B breast size, and she asked me, well, after a mastectomy, can I be bigger? I would love to be fuller. I'd love to be a full C cup range. And she also tells me that both her mother and her sister, because of this gene mutation, underwent mastectomies and elected to proceed with implant reconstruction and were unsatisfied or had issues, and as a result, I think that has colored her perception of that approach. And so she asked, is there anything else you could do or something you can do differently? So as kind of a review, there are kind of a couple of ways to approach breast reconstruction. You could do nothing, close the skin after mastectomy, and the patient can wear a prosthetic. We can use implants. We can do flaps using patient's own tissue. Or the last category is combining implants with flaps. And so if you look, the most common place where we take tissue when we use their patient's own tissue is the abdomen. As you can see, she doesn't have enough tissue to support a larger breast that she desires. Not to mention she's 23 and she's likely to have children in the future, and I don't want to cause too much abdominal morbidity. So we decided today a combined approach where, yes, we would use an implant, but importantly, we use a latissimus flap and skin from the back to augment the implant significantly. And what that accomplishes is it reduces a lot of the issues that occur with implants alone. And she was very happy with that approach. So here she is on the table for her mastectomy, at the time of mastectomy. Now, I want to draw your attention to two things. The first, I've designed the incisions, and these are nipple-sparing incisions. You can see the nipple and areola are preserved, and they're underneath the breast. They're in an inframammary position. And I designed that for the general surgeon because I'm responsible for the reconstruction. I want to ensure the best aesthetics for the reconstruction. And we'll follow that incision as we go along. The second is, look how red and kind of angry the skin appears. And this is not uncommon because taking out the breast and leaving a thin layer of skin, the mastectomy skin flap, is a huge insult to that skin. And as a result, it's not always safe to proceed with definitive reconstruction for several reasons. But in this patient, I did not proceed with her immediate definitive breast reconstruction because I'm worried about that skin. Not to mention she wants to be larger, and I don't want to stress that skin further. So I've placed what are called tissue expanders, with their silicone devices that are technically an implant, but they're nothing like a final breast implant. They're firm, they start out flat, and we expand them with saline to stretch the skin out safely and in a controlled fashion in the clinic. And this allows that mastectomy skin to really heal. So here she is. The left image is at 2 weeks post-op, the right image at 4 weeks post-op. And what you can see is that skin has started to calm down. It's not so red and angry. We didn't have any necrosis of the skin because we didn't aggressively do the reconstruction at the time and so on. You can see her incisions are hidden fairly nicely there, and you can see that we're expanding the skin. And here's continued expansion of the skin, and we're trying to get her skin to a point where she's happy with the volume. The shape here isn't as critical because we're going to change that considerably at the time of her definitive reconstruction. So the image on your right shows her in the preoperative area right before I take her for her definitive reconstruction, and she's happy with that size at that point. So here she is on the table for that. Now this is in a prone position, so her face is down on the table, and this is her back, and the line in the middle is the midline. And you see those large ellipses, those are the skin paddles that will be used with the underlying latissimus muscle for the flap portion of her flap plus implant reconstruction. So here's that skin paddle that's been dissected out on top of, superficial to, that muscle, which is shown there, the latissimus muscle. Here's the undersurface of that as it's swung around from posterior to anterior to cover and make the breast. Now, I want to point out something important with that skin component, because that skin component is de-epithelialized and buried and shaped and buried underneath the mastectomy skin. to really protect and sit on top of that implant and give a good aesthetic and volume to the breast. And so here she is at 3 months. So she again had latissimus flaps with an implant. And you can see she's healing very nicely. Her incisions are healing very well, and they're very well hidden. You can also see she's got a new tattoo on the left arm, as shown there. And here she is again at 3 months, different views. Note her donor scars. And so I've tried to hide these scars, which are big scars, they have to be, along the bra line, where they're fairly hidden when wearing a bra. And here she is at 1 year, and she was very happy with her result, but she asked me, can you do anything about the fullness on the side? I'd love for it to be less full on the side. I said, sure, I can do that. So in a small revision procedure, outpatient, at 1 year, I took her to shape things. Here she is at 1 week after that revision procedure, and here's her final result, 1 year and 2 months, with latissimus flaps, the skin all underneath, with an implant all underneath, and preserved her nice native skin and nipple with a well-hidden scar underneath the breast, which really isn't visible here. So I hope you enjoyed this patient story of No Way BRCA. It's a privilege taking care of both patients with breast cancer, but also genetic high-risk conditions for breast cancer, and helping them to achieve their aesthetic goals. As always, make sure your surgeon's board certified. Ask for preoperative and postoperative pictures. We'll see you for the next patient story.